Cats don't age on a set timeline. Some stay playful and spry for years, while others show signs of aging much sooner. So how can you tell if your cat is biologically getting older? In this video, we'll uncover the undeniable signs of aging and how you can support your feline friend through their golden years. Number 1. Achy bones and creaky joints. Aging comes with a lot of aches, pains, and general wear and tear all over your body. If you have arthritis, you'll know just how difficult it can be to move the way you want sometimes. Your cat can suffer from this too, especially as they get older. The older your cat is, the more likely they are to suffer from arthritis. It often starts to affect them when they reach mature adulthood, so anywhere between 6 to 10 years old. Senior cats over 10 years old are the most likely to suffer from joint and mobility issues. Like it does with us, arthritis can make it difficult and painful to move. Felines with arthritis move much more swiftly than they did as kittens, particularly when they've just woken up from a nap. They're just not as flexible as they used to be. Arthritis can affect their posture too. Some aging cats walk with an arched back or neck if the pain from their joints prevents them from moving properly. Or they might have a limp that gets worse whenever their arthritis flares up. While it can be alarming, it's a normal part of aging, even for cats. Number 2. Getting too old for this. As your cat gets older, you might notice them spending a lot less time in high places, at least high places that are difficult for them to get to. With their aching joints and stiffness, it's much harder for them to jump as well or as high as they used to. They might have been able to leap from the ground to the highest perch of their cat tree when they were a spry young adult. But as a senior, just the thought of such agility makes them think, "I'm too old for this." Not only are their joints not up to the task, but they might have poor vision that makes judging leaps much harder, and they often lose muscle mass as they age. Some aging cats even find it difficult to hop onto your bed or couch to join you for a nap. But this doesn't mean they don't still appreciate high places. They just prefer having an easy way up rather than making epic leaps. You can help make their favorite spots more accessible by using ramps or box steps. These give your cat a sturdy and safe way up so they can still enjoy curling up with you at night or watch the view from their cat tree. Number 3. Lowering their grooming standards. Mobility issues have another effect too. For many cats, their increasing age means they find it much harder to groom themselves. It's no wonder either. Watching cats groom themselves just proves how flexible they are. The only place they can't reach is that spot right at the back of their neck. As they get older, arthritis and other problems can make it much harder for them to bend the way they need to. It can make grooming painful too. Your aging feline just might start looking very unkempt despite their best efforts. If you have more than one cat, you might find they take care of each other. Allo-grooming is a big part of social behavior for cats. It helps them bond and tend to their fur. Your senior kitty will benefit from their feline friend's attention even more than they used to. But you can help too. It's especially important to help your senior cat with their grooming needs. A good brushing session doesn't just keep their fur tidy and promote hair growth. It gives you the chance to look for skin infections, parasites, fleas, or injuries. The right brush can even help massage their aching body and help them feel a little better. Number 4. Sleepy kitty. This one might be a little harder to notice, especially considering aging is a slow process. You might not realize your cat has started sleeping way more often than they did as a kitten because it's not an immediate change. Many cats get slower as they get older. They might be just as playful, but they also tend to sleep more often than younger kitties. This is because they have less energy, and again, arthritis bothers them less when they don't move around. Since they're sitting still anyway and they're warm and cozy, they might as well take a nap. Number 5. Just not hungry. Unlike middle-aged cats, senior kitties tend to have a much more stable weight because of appetite changes. Compared to young cats who are always on the go and burning off calories, middle-aged cats are prone to obesity because many of them eat as much as always and then sleep. Because of their limited activity, they tend to gain weight very quickly. Once they hit their senior years, however, many cats naturally start to eat less depending on their metabolism. Since they're generally far less active than younger kitties, this change in appetite means they can often maintain a healthy weight without running around too much. This change isn't usually that different from their usual diet, so watch out for big changes in appetite, especially if your cat stops eating altogether. This might be a sign of another, more serious issue than aging. Senior cats also tend to be less likely to gain or lose weight, but this doesn't mean it's not impossible. Obesity is still a serious health problem, even for aging felines, and sudden weight loss can be a sign of health issues too. Number 6. Watch for changes in the senses. Most of the time, you might not even realize your cat is having trouble seeing or hearing as they age. Often age-related vision or hearing loss occurs slowly. Since your cat has time to adjust, you might not notice at all until their vision is poor enough that they do start to walk into or fall off things more often. Or maybe your cat no longer reacts at all to fireworks, thunder, or other noises that used to scare them. Slow changes aren't the only thing to watch out for. Older cats are also susceptible to developing conditions like cataracts or glaucoma, which can both cause permanent blindness if left untreated. Sudden hearing loss can be a sign of other medical conditions too. Number 7. Cloudy eyes. Not all cloudy eyes are a result of cataracts. Some cloudiness is a completely normal part of aging in cats. As your cat gets older, they might lose the youthful brightness of their eyes. Instead, their pupils take on a transparent cloudiness or bluish haze. This is known as lenticular sclerosis or nuclear sclerosis. It mostly affects cats once they reach 8 or 9 years old. It's commonly confused with cataracts because of the cloudiness, but most of the time it doesn't affect a cat's vision at all. While cats with this condition can still develop cataracts, it doesn't mean they definitely will. It's believed to be a result of the lens of the eye becoming denser with age due to the newer lens fibers compressing the old cells. Because of this, it's considered to be a regular part of aging, and there isn't treatment for it. Number 8. Getting caught short. If your cat is upset for any reason, their litter habits are a good indicator. But they don't just miss the litter tray deliberately. Sometimes that poop in the middle of the floor is a complete accident. Older felines often have health issues that might make them incontinent or affect their ability to make it to the litter tray on time. It might even be the litter tray itself that's the problem. Your senior cat might not want to jump into that tall, covered litter tray anymore because that means jumping out again afterward. Or maybe the only litter tray is all the way upstairs and they're not feeling up to tackling the staircase. If your cat does have severe mobility issues, switch to a litter tray with lower sides so they can get into and out of it easily. Having several around the house can help make sure your cat is always close to one when they need to go too. Number 9. Teeth aren't as sharp as they used to be. Most commonly, older cats tend to be much more prone to dental issues. Their teeth aren't getting any younger, and if you don't help them take care of them, they can suffer from the same dental issues we do. Dental problems often start to appear in cats who are between 4 to 5 years old. This doesn't mean they won't affect younger cats though. It's less common but not impossible, so make sure you look after those young teeth too. Getting an early start on tooth care also makes preventing serious problems later on much easier. How old is your cat in human years? Cats frequently live into their 20s, especially if they're indoor kitties. One cat, called Cream Puff, lived to the ripe old age of 38. This is even more impressive when you realize 38 cat years works out to be about 168 in human years. See, cats don't age the same way we do. Their first year of life is the equivalent of 15 years in human terms. By their second birthday, they're already in their 20s at 24 years old. After that, they do start to age more slowly, with only 4 human years added on for each year. Because of this, cats are considered to reach their seniority when they're 10 to 11 years old. In comparison to us, they'd be around 60. Your cat might show signs of aging, but it can be difficult to know exactly how old they are. Check out this video to learn more about how old your cat really is.